So is there anything that you need for this stress right now?
Hi, my name is Francesca, and I am 26 years old. I grew up in Catonsville, which is near Baltimore. And about 3 years ago, I fell on ice in Michigan and hit my head. And so it was shortly after that I experienced a week of dizziness, but then I didn't really notice a huge difference. So it was about 6 months after that I started experiencing a lot of terrible symptoms. And it took a very long time for the doctors to diagnose me, about 1.5 years. And then I heard about craniosacral therapy and got a referral to Dr. Murray, and that's been a huge help in my life.
What really makes my work different than traditional medicine is that traditional medicine looks at all the systems in a very separate and isolated way, where my work looks at the entire body and where the rigidity and or lack of motility lies. Those are the roadmaps that guide me to do the multiple manipulations that I do that ultimately influence normalization of the nervous system.
Before I saw Dr. Murray and I was having all those concussion symptoms, I was experiencing a lot of dizziness. A lot of times I would have trouble walking because my equilibrium was just so off. Issues with my vision. Reading books has been really hard because the words just bounce around. And it would affect my cognitive ability to understand what I was reading. Also, constant fight or flight response. So like moodiness and irritability, definitely the most irritability I've ever experienced in my life, and tearfulness, and just a lack of ability to concentrate, along with more pain in my body. My muscles just tensed up a lot.
In order to better understand manual regulation therapy and how it works, it's important to know what happens to the brain when it's injured. A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain.
When a brain injury happens, the first thing that occurs that very few people even take a look at is that the dura mater, the lining of the brain, is innervated by the sympathetic nervous system. As a result of that, the impact on the brain causes a contractility of that membrane, and then that reduces the motion of all the fluids in the brain, meaning the venous fluids, the lymphatic fluids, the cerebrospinal fluid, and some of the arterioles in the brain.
So in a typical visit, I come in, Dr. Murray asks me how I've been. I lay on the table, just like, you're going to get a massage, but I'm laying on my back. And then he starts usually at my feet and just, it's just light manipulation. So he does a body scan using my feet, and then figures out which part of my body is most congested or rigid, the part of my body that needs healing. And then he'll go and he'll start there with just a light touch.
It's interesting, but I just start out with the feet to get a read into her body. So again, the first place she takes me is into that left hip. So I can tell there's a certain motion that goes on in the body. And generally this external and internal rotation. And I can feel that it's restricted up in that left hip. And I can feel that all the way through into the ankles. And so that's what we're doing at this point. We're getting a read into the body, and this is more of a general read. Then we come through and we do a much more isolated listening, or doing a more isolated read into more specific structures as we go through.
So Dr. Murray does a couple of different therapies: visceral manipulation, somato-emotional therapy, along with craniosacral and myofascial release. And basically what that means to me is, with his gentle touch, he's basically bringing the body back into alignment. He's responding to the congestion or the rigidity in the body with the automatic nervous system, and he's using his hands to bring the body back into balance. And then with the somato-emotional release, we work through things. So sometimes when he's working on my body, I find that the pain in my body is actually emotional trauma. And so with that, we talk through things. He reminds me of my value. And with that has been so powerful. I've felt empowered talking to him, and it's helped me to let go of things that have been hurtful in the past.
So how we know that it works? Well, there are two sides of that story. One is, from my perspective, there's always an increase in motility of the things that I find the restrictions or the rigidity in. In terms of the patient, there are going to be all these cognitive changes, reduction in headaches, reduction in visual problems, and a reduction in symptoms in general. So that's the icing on the cake.
So working with Dr. Murray, I've seen huge changes in my body, which has been really encouraging, seeing so many physicians that didn't know what to do. And so some of the biggest have been my cognitive ability. I can think so much clearer. I finally can add back like numbers in my head, which has been huge, because I studied math in college, and when I couldn't do that anymore, that was really hard. So my cognitive ability, less brain fog, more ability to concentrate. My neck doesn't hurt anymore, which is huge. My digestive tract feels a lot better, and my pain's less.
Traumatic brain injury is a very difficult injury for many people to deal with. People take a lifetime looking for the right help and not getting it.
If you, a loved one, or friend are currently struggling with post-concussion symptoms, I strongly encourage you right now to make an appointment with me to experience the amazing benefits of manual regulation therapy.
I am so glad that I found Dr. Murray. I'm thankful for him in so many different ways, because there were so many doctors that didn't know what was going on with me.
Get yourself back in a better place again. I would strongly recommend that you get in touch with me at ronmurraywellness.com and get yourself back in a better place again.